Our underreported stories segment tonight, more good news related to COVID-19. New data from Minnesota, New York City, Seattle, and Chicago find no uptick in COVID-19 cases following the mass Black Lives Matter protests. While the mainstream media is roasting President Trump for holding campaign rallies, decrying it as a risk for COVID-19, even though the same mainstream media said nothing about the COVID risk during the Black Lives Matter protests. Thankfully, according to the Wall Street Journal, these mass gatherings have not caused COVID cases to spike, which does make sense based on the science of outdoor events and the transmission outdoors and the young age of the protesters. There is positive news on other fronts, too. Sweden recorded their first week with no excess mortality since the pandemic began, and a North Carolina antibody study showed 8 to 10% of the population has COVID antibodies. This is 15 to 20 times the rate of active infections and pushes the infection fatality rate to the between 0.1 and 0.15% range. Of course, the media is still playing the role of doomsday prophet when it comes to COVID-19, so we will tell you the truth. With me now to do so, Senior Research Fellow at the American Institute for Economic Research, Phil Magness. Phil, good to see you.
Yeah, thanks for having me.
All right, Phil, talk to me about this new data. Minnesota, New York City, Seattle, and Chicago, of all the places that you might expect to see an uptick in COVID cases, those were 4 places that saw massive protests.
Right. So we had a mass wave of testing that followed the weeks after the protest. And we know this disease, it incubates up to about 14 days. But the testing data is coming in, and they're estimating that maybe 1% of the people at the protest rallies are now testing positive for COVID, which is a very low number. It's consistent with historical other events that have happened during the pandemic that the media was playing as doomsday, and yet it's turning out that there's not a mass infection that's following these events.
And why do you think that is? Do you think it's because these events were outdoors and it's more difficult? I think there was a Japanese study that said that transmission outdoors was 18 times less likely than transmission indoors. Or do you think it's related to the age of the protesters or herd immunity? Or what do you think this is from?
I think it's a variety of factors. As we've seen since the beginning of the pandemic, it's been overwhelmingly concentrated among elderly persons with other comorbidities, and really the nursing homes. But the media has tended to portray it as like this mass disease that's taking place across the general population. But what we really have is something that's concentrated in a very narrow, defined area that is often close quarters, so residential facilities and nursing homes.
Interesting. And then this is of course counter to the lockdown narrative, which I know that the media was hypocritical about not decrying these protests, even though they decried the anti-lockdown protests. Similar groups, mass groups of people, one okay, one not okay based on the politics. But the fact that there's no increase in infections is counter to the lockdown narrative, as is the data out of Sweden. So this data, there's a little bit of a lag in the data. So it's not this week. It wasn't last week. It was the week before that they were reporting on. And they had their first week with no excess mortality since the pandemic began. What do you make of that? Do you expect there to be a lag in data where they end up adding to the mortality data, or is this evidence that Sweden's strategy is working?
I think it's a vindication of the strategy taken by Sweden. And again, we see the places where Sweden had deaths that spiked in very significant ways were nursing homes. And that was the acknowledged deficit of the approach that Sweden took. But back in the general population, they were able to survive this pandemic pretty clearly without going into harsh economic lockdowns, without putting repressive measures in for society. And they've done no worse than some of their counterparts in Western Europe, and in fact, quite a bit better than some other countries.
Yeah, it's interesting. You don't hear that story, by the way, on the mainstream media. Meanwhile, in British Columbia, in Canada, and in New Jersey, here in the United States, there have been drug overdose deaths that have far exceeded the number of drug overdoses at similar times in years past. For example, in the British Columbia, drug overdoses have killed more people there than COVID-19 has killed all year. In New Jersey, 10 people a day are dying or died last month due to drug overdoses during this lockdown. I mean, there's evidence that lockdowns, A, didn't work if we look at Sweden, and that lockdowns, B, actually lead to deaths that are non-COVID related.
That's absolutely the case. This is something that we've known in economic data for several decades. Whenever there are recessions and downturns, periods of mass unemployment, there are spikes in substance abuse and there are spikes in suicide. And both of these were experienced after the 2008 financial crisis. We've seen it in previous recessionary depression events. So it's not a surprise that this lockdown period has resulted in a similar type of phenomenon happening.
Now, how would you respond to Imperial College London's very own Neil Ferguson? He was the author of the initial model that essentially sparked the mass panic around the entire world, said that 500,000 Brits would die, 2 million Americans would die if we didn't lock down. He says that the problems, meaning why the lockdowns didn't work the way that he said that they would work, was because the lockdowns were not implemented quick enough. They came too late. What's your response to that?
Well, he's basing this off of his model, and his model kind of bakes into the data the assumptions that lockdowns are effective. The way that they calculate the effectiveness of his model is they take his projection and just subtract the actual death tolls. That does not pass the smells test for social science, for good scientific analysis. No credible statistician would put stake in a claim like that because the causal mechanism has not been demonstrated. They haven't proven that this policy does what it claims to do. And every time you ask them about it, they just go in this self-referential circle of citing their own studies.
Yeah.
But that really doesn't vindicate what they're doing.
Right, it's essentially opinion, premise, and assumption, and you can't prove something based on opinion, premise, and assumption. You have to have actual proof to prove it. Phil,
Absolutely.
thank you so much for being on the show. I really appreciate it.